I think Ruben just answered the phone. Joining us here in a couple of seconds is Dr. G.E. Ghali. He is the Chancellor at LSU Health Science Center. All guests on Keel heard via the Jack Spring Electric Keel Newsmaker hotline. Dr. Ghali, welcome back to Keel. Hey, how you feeling? Tell us what's up.
Hey, I'm great. How are y'all doing?
Good. You tested positive Sunday for COVID-19. What made you go get the test?
Well, Aaron, I had a little bit of a fever. I woke up feeling feverish on Sunday, probably about 4 in the morning. I woke up. I said, God, I kind of feel like I got a fever. The day before, on Saturday afternoon, I had a little bit of a cough, sort of an innocuous cough. I just thought it was an allergy, which I have quite a bit of allergies. Took an allergy pill, and then on Sunday, when I woke up, I had a fever. So I went and took my temperature, and sure enough, it was about 102. And so I said, I better go get a test real quick. So I went into our EVT lab, and Dr. Kevel did a test on me, and sure enough, it was positive.
Okay, you were at the governor's briefing on Thursday. Is that where you think you got it?
No, it's hard to know. It really is. I also on Thursday, I saw some 35 or 40 patients that morning before I went down to Baton Rouge. So I could have got it from a patient, from one of my patients. I could have got it from a patient in the hospital a couple of days before that. It's really hard to know. With the incubation period being anywhere from 2 to 14 days, it's really difficult to know exactly when. But certainly when I was with our governor, we were wearing masks and we were socially distancing of more than 6 feet and everything. So he certainly didn't get a close contact with me, nor did any of his staff, really.
But on the other hand, you've been masked up, gloved up, screened, or shielded up for some time, and I would imagine the people around you, save for the patients probably, had been. What does this say, if anything, about masks and shields and gloves and everything else?
Well, it says that they're not perfect, and we know that they're not perfect. But certainly they're very, very beneficial, and we need to keep doing that. The reality is nothing in society or nothing in medicine is 100% perfect. I would say, had I not been wearing a mask, who knows? Normally, I'll tell you, I haven't been sick since. When I say sick, I mean with a cold or anything like that since December. I tell you, I got something in December that kind of made this coronavirus seem like it was a Girl Scout cookie.
A lot of people have said they were sick back then in December. Yeah.
Yeah, and although I got tested when we got into the springtime to see if I had any antibodies, and maybe that was coronavirus in December, even though it wasn't necessarily that popular in the U.S. at the time. But those antibodies have all come back negative at that time. But I would tell you, and it's also not unfair for me to compare what I had in December, which I received basically no treatment for, compared to what I had this time, which I went and got maximal treatment at our OLHS hospital. Which, by the way, notwithstanding the fact that I'm a chancellor, they took excellent care of me, like they do every single patient that goes into that hospital.
Let's talk about your treatment. Let's talk about your treatment a minute. What kind of treatment are you getting?
Well, right now I'm getting nothing because I'm out. I'm back home, and I'm doing great. Literally, other than an occasional mild headache, I feel great. The treatment that I got was sort of based a little bit on my medical history. I happen to be on a particular medication for a medical condition that I have that makes me a bit more susceptible. Some people would say even somewhat immunosuppressed in some circumstances. Because of that, my doctors decided to start me on remdesivir, of which I got 5 rounds of treatment. and then also 1 round of convalescent plasma to kind of bridge me until hopefully my own body can begin making antibodies toward the COVID-19.
Did you have to
so
stay in
that's what I got 5 rounds.
Did you have to stay in the hospital at all?
Yeah, unfortunately I did, Aaron, because the remdesivir, particularly with emergency use authorization, EAU, by the FDA, it sort of requires inpatient treatment. It's an IV, and it's not something you can really get on an outpatient basis.
I'm certainly not looking for any kind of like endorsement here or anything, but you had mentioned your own degree of being immunosuppressed. Were you taking anything to build that up, like zinc or vitamin D or anything, any of those supplements that you see that a lot of doctors are recommending?
Not really. I haven't not been. But I try to just maintain a balanced diet and get some regular exercise, and that's pretty much what I do.
Dr. Ghali, let me ask you, as the Chancellor of LSU Health, what are you doing around the house? Are you having to steer clear of your family and lock yourself up in the basement?
So I've my wife and my 4 kids. It's hard. No, I'm not locking myself in the basement. Basements aren't so popular in Louisiana, are they?
Right.
We don't have a lot of basements. But I will tell you that they've been isolating from everyone else outside of our family unit since Saturday. And so they really have not been out anywhere. And so they've basically been isolating. And we're going to isolate for 2 weeks. And so I was pretty much isolated in the hospital, and now I'm coming home, and so we're going to isolate through the end of next weekend, and then they'll be starting school, hopefully, Lord willing, on the 17th. They've all tested negative, and the kids, and
okay, good.
They're doing great, and we're just going to stay self-quarantined, basically.
Gotcha. Dr. G.E. Ghali, we wish you the best. Thank you for joining us this morning. I didn't know if you'd be up for it, and I really appreciate it.
No, I'm up for it, and I appreciate the coverage you guys are getting. I know the governor appreciates the very great coverage that you guys are doing, and the numbers are continue to go up a bit. I do see that we're on a nicer trend over the last 7 days or so. I'd like to see that continue for another week. But we've seen over 11,000 new cases in Louisiana just in the last week. That's better than 20,000, which was the trend that we were going on. But I think we're going in the right direction. So I thank everybody for everything they're doing. I thank everyone for the great wishes that they've been giving me on social media and texting me and things like that. We have a great community, and I want to thank everyone, and I want to thank y'all too.
Absolutely. Dr. G.E. Ghali, Chancellor, LSU Health Science Center in Shreveport.
Pleasure, sir. Thanks for your time. Glad you're feeling better.
Love you. Thank you, guys.
Thanks.